The radical ideas mean healthy lives could be cheaper. Credit Alamy families could get discounts on their supermarket shopping if they hit weekly exercise step targets under radical NHS proposals. Free bikes, sprinting tracks on pavements and outdoor public gyms are also proposed as part of efforts to drive out couch potato lifestyles and reward those who try to shape up. The head of the health service said the schemes, which will be piloted in new towns, aim to create a design for life which would persuade young and old out of sedentary habits. Under the proposals, those who meet weekly activity targets, tracked on apps, could be offered discounts on weekly supermarket shopping and sports gear, free cinema tickets, or cut-price gym membership. It's time to rip up the rulebook for town planning and embrace innovative solutions to get people back on their feet. Stephen Ward, chief executive of UK Activate Housing Developers, will be asked to provide new homes with free bikes, in a bid to cut car use and promote cycling, health officials said. The ideas are part of an NHS policy to create 10 healthy new towns which are piloting new ways to encourage more active living. Health officials are examining schemes introduced by health insurers, which have given customers up to 25% off their weekly Ocado shop if they hit monthly exercise targets. Other initiatives under scrutiny include free cinema tickets for those who achieve 12,500 steps at least 3 days a week. Mr. Stevens said if there's to be a much-needed wave of new house building across England, let's design and health from the start. Everyone wins where children can walk to school and play safely outside. Everyone benefits when people can easily walk to a nearby shop and where neighbors can get to know and look out for each other, he said. 1 in 5 children starting primary school is obese or overweight, rising to 1 in 3 by the time they leave. Smarter planning would help to design out childhood obesity, said Mr. Stevens, who said the ideas point the way to how new communities should be designed in future. Simon Stevens said health should be designed into new developments. Credit PA health officials said some of the boldest ideas in discussion are in Cheshire, where discounts, free bikes with new homes and sprinting tracks are under discussion. A scheme in Oxfordshire has begun offering families the chance to win prizes such as Fitbits for competing in exercise challenges. The sites enrolled in the programme so far cover more than 76,000 homes across England, in Whitehill and Bordon in Hampshire, Cranbrook in Devon, a new development in Darlington, Barking Riverside in London, Haltonley in Runcorn, Cheshire, Windyke Farm in Fylde, Lancashire, a new community in Bicester, Oxfordshire, Northstowe in Cambridgeshire, Ebbsfleet Garden City in Kent and Barton Park in Oxford. All are drawing up detailed plans which attempt to encourage healthy lifestyles and improve access to healthcare and community support. In Darlington, smart homes means the NHS will be able to use technology to monitor the health of older residents with health conditions. And the Bicester scheme, Oxfordshire promised to offer 40% green space, with pedestrian and cycle networks and allotments to grow food. Walking levels have fallen by more than a third in 3 decades, with official statistics showing HTE average person now walks for less than 10 minutes a day. Mapped England's obesity hotspots. Health and fitness experts welcomed the ideas. Stephen Ward, chief executive of UK Activate, the old approach to healthcare has left Britain lurching into a physical inactivity crisis which threatens to bankrupt the NHS. Modern living has stripped movement out of our daily lives, so it's time to rip up the rulebook for town planning and embrace innovative solutions to get people back on their feet. Tam Fry, from the National Obesity Forum, said if this works, it can be a win-win situation. The incentive can bring in more business for firms taking part and motivate people to be healthier, he said, suggesting that the cost of buying a bike for each home was peanuts for housing developers. The NHS ideas under discussion: free bikes with all new homes, discounted supermarket shopping in reward for achieving a weekly step count, sprinting tracks marked out on safe pavements connected to public gyms via urban obstacle courses, outdoor cinemas and community squares to encourage communities to socialise on foot, cooking lessons for local residents.